So I'm going to take you through what happens during an FUE procedure here at Terra. So in the morning of the surgery, our patient comes in and he's prepped for surgery. We'll do a hair wash and shave the hair to an appropriate length. What's then done after that is a series of photographs will be taken for documentation. We will then get the patient to come into the operating theatre and check his particulars, any drug allergies, any safety considerations that we have to all know as a team. The patient will then be faced lying down, and local anesthesia will be injected into the back of the scalp to numb the donor area. Once we have confirmed that the patient has had adequate anesthesia, we will then proceed to inject a tumescence fluid to support the grafts. The FUE extraction process is then done using a punch system that is most suitable for the patient's skin type and graft type. At Terra, we use a few different punches depending on the patient profile and what kind of effect we are trying to achieve. Individual hair follicle unit grafts are then extracted using this punch. A surgical assistant will then extract these grafts using forceps, and they are handed to a team of hair technicians. The hair technicians will look at these grafts under a microscope. They will be differentiated into singles, doubles, triples, or even higher order multiple grafts and checked for their quality. What we are looking for in these grafts is the grafts that contain the entire hair, including the bulb, as well as sufficient tissue to support its growth. The grafts that have been sorted are then stored in a solution called hypothermism, which is supposed to keep the grafts alive for up to 48 hours outside the body. These grafts are then put into a chiller at 4 to 6 degrees centigrade to ensure their survivability. At this point, we've got the total graft number. Our patient is then face up. We are going to do the anesthesia for the recipient area. Sometimes we will use a supraorbital nerve block or a ring block to anesthetize the recipient area of the scalp. At this point, our patient should feel quite hungry and we all break for lunch. After lunch, we start creating the recipient sites. Each site is created with customized blades. The blades are actually measured against the size of the grafts and the depth of the grafts so that they are never put too deep or too superficially. That ensures natural growth without any pitting or cobblestoning. After the sites are made, the hair technicians then skillfully place the grafts into each individual site. The entire process can take anything from between 4 to 6 to even 12 hours. And at the end of the procedure, we'll be applying a bandage across the donor area to prevent any infection. The recipient sites are then cared for using a calcium stem cell serum. Once all the parameters are checked, our patient is then ready for discharge. We usually advise our patients not to drive home but take some form of assisted transport because at this point they may still be a little bit drowsy. So immediately after the procedure, specific instructions are given to our patients to make sure that the grafts have the best chance of survival, and these include keeping them moist with a saline spray, and every 3 hours we're still going to be using that calcium serum. Our patients would have been given our phone number to contact us should there be any emergencies overnight. The day after the procedure, our patients come in, we remove the bandage and we do a wash in clinic. We also teach the patient how to wash their hair for the next 7 days. Strict adherence to this protocol ensures best graft survival. So I hope this video was helpful in explaining the hair transplant process to you and got you more interested in the hair transplant process. Continue to follow us for further details on different types of hair transplants, such as eyebrow transplants or facial hair transplants, and the different equipment we use in our clinic. See you next time.